So let's talk about Jack for a second. He came in, PSI is climbing, 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 and you knew that there could be hope for Jack.
So the situation with Jack was that he had had full course radiation in 2009. And in 2015, his PSA was climbing. And in 2016, they did some studies and found that the only place that his cancer had recurred was right in his prostate gland. And so they did biopsies and proved that. They did special scans in Phoenix looking for any cancer anywhere else. It was only in his prostate gland. And so he's a healthy retiree, enjoying lots of physical activity. What does he do now with cancer coming back after primary radiation? And I felt that the combination of brachytherapy with hyperthermia gave him a definite advantage over any other treatment. And so Jack went through a series of 3 brachytherapy treatments along with 3 hyperthermia treatments. And it's now been a year and a half, and his PSA is undetectable, and he's doing his usual activities.
So how do you describe the transformation here? Another miracle?
You know, I think it is a little bit of a miracle to take somebody at his age and render him free of cancer at least a year and a half down the road after he's had traditional full course therapy. And our treatment, I was able to lower our dose of brachytherapy because of the hyperthermia, which gives us a little bit more oomph and power to that treatment. And I think made the overall treatment safer for Jack.
Good. What was his other alternative if there wasn't this combo of hyperthermia and brachytherapy? What would have been his option?
So at his age, his option is medication, and that is medication that alters his hormone status. And so we take the male hormones called androgens and we suppress them. And that works for a period of time. It doesn't get rid of the cancer.
So knowing that he had an aggressive cancer, prostate cancer, would it have really stopped or just delayed a little bit?
It would have delayed it, hopefully for years, but those medicines have a systemic side effect. Jack likes to play tennis, he likes to do other very active things, and those medications can have an influence on that.
Alter his lifestyle.
That's right.
And then is it because of his age that there would be no recommendation of chemo and that?
So because of his age, because of his age, he wouldn't have surgery to completely remove the prostate.
I see.
And so the only 2 curative methods at that point that really work well include surgery and radiation therapy. But because of his age, surgery was out.
Ouch.
And so the other treatments are control things but don't get rid of the cancer.
Gotcha. Okay. Good. Anything else you want to say?
Let's see. So about Jack in particular,
Yeah.
okay. I think I've said it pretty.
Yeah, you've said,
Yeah.
I mean, we've interviewed you for other. Okay.
And so the other question was, the other questions you've asked me, I don't know if you want me to, you know, you asked me about why did it kind of go into a lull period of the hyperthermia.
Oh, yeah.
And I really think that one of the responses to that is that there are good examples in oncology where a good idea is tried, and the initial try doesn't work that well, but they come back years later and things work better. They've figured things out in a more, you know, in a way that makes the treatment more safe and effective. Mm-hmm. And a good example of that would be the combination of chemotherapy and radiation before surgery, which is now we do that all the time.
So can you go back before, when in the trials and the idea it was just used alone and that was the problem, right? Can you just pinpoint?
No, that's not the problem. So
the specific of before and then decades later.
Okay, so the main trial that kind of caused the downturn in interest was one that had too many patients who were not heated adequately. And so the equipment over time has improved itself and been made better so that a very similar study, if it were done today, I think would likely have positive results. Okay. And then we've got, very recently published a phase 3 study. We call that level 1 data that shows a major improvement in survival with the addition of hyperthermia. And so it's a modality that is just too promising to just let it go by the wayside. Mm-hmm. And we need more studies. Yeah. And I think that, for me with my training at the University of Utah, mm-hmm. to ignore all the positive literature and just leave this alone, to me, is unconscionable now. Mm-hmm. Because there are too many patients that I think can benefit as a result of the improvements in hyperthermia. Yeah. Now, in a state our size, I've mentioned before, it's not every patient that needs hyperthermia by any means. But when conventional modalities have failed them and they have a problem lesion, mm-hmm. hyperthermia can give a big boost to either chemotherapy or to radiation therapy.